Hi, I'm Dr. Ashim Desai. I'm a consultant ENT surgeon working at Apollo Spectra hospitals at Tardeo in Mumbai. My area of specialization is surgery for deafness, including middle ear, inner ear diseases for cochlear implants and external auditory canal atresias. Other area of interest is endoscopic sinus surgery and surgery of rhinoplasty, that is the shaping of the external nasal dorsum. You see, sinusitis is an inflammation of the tissues that are lining the sinuses for more than a certain number of days in the medical terminology. In reality, what happens is that 9 times out of 10, allergy is mistaken for sinusitis. And this is the problem that we are facing in our medical practice today. 9 cases out of 10 who come to us with frequent sinus issues are typically allergies, because allergies cause inflammation of the nose. Inflammation leads to blockage of the openings of the sinus, and that leads to persistent accumulation of liquids, fluids, so on and so forth within the sinus cavity. Now, as far as sinusitis is concerned, sometimes many patients complain of sinus pains, that is sinus headaches, that is in the mid face part of the face. And in reality, that's not really sinusitis at all, but it's a migraine. It's called a mid-facial pain syndrome. And the best way to diagnose is to subject the patient to a CT scan during his headache. And when you see that the sinuses are clear, it is mostly a migraine kind of headache. So, most important point that I would like to draw your attention to is that not all sinus pains are due to sinusitis. Most of the times it's due to allergies. Often it is due to mid-facial pain syndrome, and only rarely is it sinusitis. The cause of sinusitis also is frequently allergy. Frequent allergies causes frequent infection, and frequent infection leads to chronic infection, and that is called sinusitis. And again, what happens is that inappropriate and excessive overuse, misuse and abuse of antibiotics is what causes the sinus problem to become even more chronic. And once it leads to a certain level of chronicity, what will be required is surgery. Typically, the best way to treat sinus problems is to cure the allergies. As long as you diagnose your allergies, you're able to avoid whatever food articles or environmental allergens that you are allergic to, or give yourself desensitizing vaccines so that whatever substances you may be allergic to, the allergies fade away over a period of time without the use of medication, without the use of antibiotics, antihistaminics, and steroids. That is one of the best preventive ways to prevent getting chronic sinusitis. Once sinusitis occurs, it has to be treated appropriately by the doctor, by the consultant ENT surgeon. Adequate antibiotics, long course of antibiotics, and occasionally even steroids may need to be given to control the sinusitis. And in a worst case scenario, if it leads to allergic fungal sinusitis causing polyps, then surgery would be the only remedy.